Got a grade 2 tear of your meniscus? What does that mean? Hey, this is Dr. P. Got a problem with your knee? Ask Dr. P. And I get asked a lot of questions. I got asked a question recently about someone saying they had a grade 2 tear of their meniscus, and what does that mean? So there's a grading system that radiologists use, and they look at x-rays and MRIs, and they'll grade it grade 0, grade 1, grade 2, and grade 3. So I'm going to go over what these grades are and what they look like on an MRI. But first, if you recall, we have the cartilage on the end of the bone, and then we have the meniscus cartilage, the shock absorber in between. So if you're looking at the knee here, the front part of the knee is going to be right here, and the back part's going to be here, and it's like we're looking at the knee from the side. You have your femur, your thigh bone, your tibia, your shin bone, and the meniscus cartilage is in between the thigh bone and the shin bone, and this little black triangular thing. There's one in the front, anterior horn, one in the back, posterior horn. Completely normal, grade 0 is completely black, looks like a triangle, and there's no white signal. So that is a grade 0. That's a normal looking meniscus. This person unfortunately tore their ACL and they have a lot of other problems going on, but the meniscus looks great. Now if we go to the opposite side and look at the medial meniscus, you can see the meniscus again, nice black triangle, which it should be, shaped like a triangle. It should be black, but you see a little white signal in here. Now, it doesn't go to the surface, and it's not a huge amount of white signal. It's a little bit. So that would be grade 1, and that would be indicative of maybe a little bit of degeneration, a little bit of injury. It could even be a blood vessel. Younger people sometimes still have blood vessels in here, and it'll show up like that. But that would be an example of a grade 1 signal. Okay, so now we move on to a grade 2. So here is the front part of the meniscus. Here's the back part in this case, and it should be black and triangular. Now this is probably a little bit of grade 1 actually here, but you can see grade 2, much more diffuse white signal, and that's more indicative of degeneration. I don't see a bright white line going all the way through, but this is kind of more of what a grade 2 signal would look like. And finally, this is a grade 3 signal. So this is somebody's meniscus. The front part looks fine, okay? They've also had an injury, but the front part looks fine. Nice black, nice triangular, no white lines. The back part, the posterior horn, this triangle right here, it looks normal like a triangle, but you see a white line going right through it, a linear white line going right to the surface. That is a classic example of a tear of a meniscus. That's a grade 3 signal. That is a true tear. You would see that if you went in there and did arthroscopic surgery. Now, this one is not displaced, so we could probably put sutures in here and maybe some bone marrow cells and some PRP and get this to heal and repair that, but that will probably need surgery. Having said that, there are some times we can get an injection into here and try to get this healed without surgery, but that is a tear, grade 3. So now hopefully understand what all 4 grades of signal are in an MRI. So someone who asked me that question about a grade 2, that's probably not something that necessarily needs surgery. Keep an eye on it, but occasionally even with a grade 2, if it's very bright, we will inject bone marrow cells or PRP in there, especially if they're having pain and they have no other reason to have pain. I have seen some cases where we saw a grade 2 signal progress to a grade 3 when the person kept playing sports on it or whatever. So those ones I'm a little bit more apt to maybe act on.